All right, let's go ahead and get started. Okay. All right, so thank you and welcome to webinar number 11 for our COVID-19 WARN webinar. Attendees are only in listen-only mode for today's presentation. We'll go ahead and go through some preliminary information, and then we'll get going with some great information from great panelists. Okay. Okay, so during today's webinar, if you're connected through Zoom, you can interact with us in two ways. We have the chat button and also a Q&A button. So if you have things that you want to raise to our panelists, feel free to put them in either of those places. And as we have time, we will share that information. Okay, make sure that you do, if you see your chat button at the bottom of your screen, to go ahead and select it and go to all panelists and attendees so that everyone can see your questions and answers from our panelists and from other attendees. Okay, there is also a question. The Q&A box can be used to send us direct questions. Okay, we are also streaming this live to YouTube Live, so if anyone is unable to access the Zoom, you can watch it now on YouTube Live, and there will also be a recorded video available later on. And we will post the recorded webinar onto our VA WARN website later on today or tomorrow, as well as older versions as well. So if you missed a previous webinar and you want to view it, please feel free to visit us at vawarn.org. And take it away, gentlemen and lady.
All right. Welcome, everybody. This is Ike. I've got Mike Lynn and Scott Shirley on here, too. We're your current WARN chairs and future WARN chair, and then we got a great speaker on the line, and we got Scott Smith in the background trying to keep everything going for us. Next slide, Scott. So as usual, we want to welcome all of our state partners, state agencies. So VDH, Office of Drinking Water, DPOR, Virginia Department of Environmental Quality, and any other state partners we may have on. We want to thank all of our WARN members. Our WARN membership has been growing more and more as we move further along the lines with this pandemic. I want to thank all the Virginia utilities for being on board, because this presentation is primarily for you guys to try and get you as much information as we can and keep you up to date and give you as many resources as possible. Any additional Virginia partners that might be listening, we also want to thank you for being on. Okay, next slide, Scott. So our special guest today is Sarah Baumgartner. She's the Director of Public Relations with Western Virginia Water Authority, and she's put together a really good slideshow with some really good information. So I'm going to turn it over to Sarah, and thank you for speaking with us today.
Thank you for having me today. I look forward to sharing information with you about the ways we're helping some of our customers and during this pandemic to help with their bills and get them caught up. I am the Director of Public Relations for the Western Virginia Water Authority. And for those of you who may not be familiar with us, we are the water and sewer service provider in the city of Roanoke, Roanoke County, Franklin County, and Botetourt County. So all of our utilities have temporarily halted disconnections due to this pandemic for customers who cannot pay. So we're not doing any non-pay cutoffs, but we also know that this is not a sustainable business model for any of us. At the Water Authority, we've been working on some programs to help customers get caught up on their utility payments before we start disconnections. And we've been developing some messages to help our customers understand the importance of what those payments do for our community, because we realize a lot of people just pay for their service and they don't actually think that everything that we do is actually funded by those water and sewer payments. So it's a good opportunity for us to get that message out. Next. Back in 2016, we partnered with an organization called HomeServe. that offers service line insurance to our customers. And we looked at a lot of different insurance companies, selected HomeServe through an RFP process. If you're interested in learning more about that, that's a different topic, but I'd be happy to answer questions about how we went through that process and how we ended up with HomeServe. But one of the things that was common across all the organizations we looked at was when those companies sell one of their service line products to our customers, a commission from that sale and from each renewal is sent back to the utility. And we use those funds to establish a program that we call Authority Cares. And this is a utility relief program to help customers who may not be able to pay their bill. Prior to having Authority Cares, we would refer customers to various charities and agencies and faith-based organizations in the community who can make pledges to help those customers. But it's a little bit more organized now with Authority Cares. Next.
Did you want to launch that poll question?
Yeah, so we're going to launch a poll question just to see how many of you currently have a relationship with the Service Line Protection Program. So if you could answer those questions, thank you.
So for those of you that are just listening in and aren't able to follow along with the slide, the question is, do you currently have a relationship with a service line protection program? And the answers are yes, no, I don't know, and does not apply. And as soon as we have the results, we'll share them with everybody.
Give everybody just a few more seconds and then we'll share the results.
All right, so our results for Sarah's question here is 7% voted or stated yes, they do have a current relationship with the Service Line Protection Program. 42% say no. 22% do not know if they have a relationship with the Service Line Protection Program, and 29% are saying it does not apply to them. Okay,
Thank
Sarah.
you for answering that. And for those of you who don't have the Service Line Protection Program relationship, if you're interested in learning more about our process, like I mentioned earlier, please feel free to contact me and I'll walk you through the steps we took.
Okay.
So I mentioned that we get a commission from HomeServe for every one of their sales, and the commission is 15% of every product that they sell. Here's a graph that shows you kind of what those commissions have looked like since we started this program. To be honest, we get more in commission than we thought we would. We average about $10,000 a month in commissions. And one of the things that we did early on is we made the business decision that that money from the commissions, whatever the amount was going to be reinvested back to help our customers. So we could have put the money in operating or capital, but we decided that this would be a great opportunity to help our community and set up a fund to help customers who are having difficulty paying their utility bill from time to time. Next. We also knew going into this that we wanted to do more than just a one-time assistance. So if somebody was having trouble paying their utility bill for the water authority, paying about an average of a $60 a month bill, that they probably were having other financial issues too, paying electric bills, paying rent, food, medication, whatever it may be. And we also knew that we did not want to be in the position to vet each of our customers to determine who would get assistance and how much that assistance would be. So we reached out to the experts in this area. And for us, that was our local United Way, who works with many different agencies to help people who are in need. And the United Way helped us set up a program through the Community Housing Resource Center to vet the customers, determine financial eligibility to get assistance, and to make the pledges to get the need that they had for their water bill. But they also are working with those customers to see what other underlying issues are there, and they can refer them to other agencies. They can make pledges for other needs those customers have, and work with Freedom First Banking to help with some banking needs for those customers. Next. The Authority Cares program at its core really helps the customer receive the immediate assistance they need. The customer reaches out to Central Intake or Authority Cares because they are not able to pay their utility bill and they've received a disconnect notice from us. So we're helping with that immediate need. But there's also other benefits to this too. We have found that it saves personnel cost for the Water Authority because we're not having to send a person or a team out to do turn-offs and turn-ons for these people. The funding is typically pledged and it stops a turn-off from happening. We also can work with the outside agency to assess each customer's needs and help meet other needs they may have, which generates long-term stability solutions. And we have set up the program so that if somebody asks 2 times in a calendar year for assistance from Authority Cares, before they can get a third amount of assistance, they need to contact the Freedom First Banking program through United Way and go through the financial coaching program. We also let the other organizations, those charities and faith-based organizations that had been working with us on pledges from time to time, know that we were not going to be reaching out to them for pledge dollars anymore, and they could direct that money to other needs, which they were pleased with too. Next. On average, we have about 34 customers a month who do receive some sort of pledge from the Authority Cares program. The average pledge is about $144. We do see that the amount of the pledges is trending up, as is the number of pledges right now due to COVID-19. People have more delinquent amount on their bill and more financial issues. We saw in the time period between late February and May, we started seeing people not calling to get pledges because we stopped disconnects, and without the driver of your utility disconnecting your water service, there wasn't the need in that person's mind to get a pledge. But we have been sending out messages since May to let them know that we will be starting disconnects again and that they do need to get help. Next. The way the pledging process works is we have a form on our website that the organizations who want to make a pledge can go and make a pledge. To have some security to this and to have validity, we have a unique code that is assigned to each organization, whether it be Central Intake that does the Authority Cares or any of the other prior pledging organizations that still from time to time will occasionally make a pledge. This form is sent to our billing and our customer service and our IT department automatically when it's filled out. And if the code and the contact person's name and the pledging organization do not match, then we know that we need to reach out and find out if this is actually a legitimate pledge for somebody or not. Next. Our messages about the program are printed on each delinquent bill. It says that if you are delinquent and you need assistance, please reach out to Central Intake with their phone number. We also put inserts into our delinquent bills to promote Authority Cares. So many of our customers, the vast majority, don't even know about this program because the messages only go into people who are delinquent, not to the people who pay on time or before the bill becomes delinquent. The messages we have been doing basically say, do you need assistance paying? And if so, we can offer help and contact central intake before your bill is due for disconnect. Next. Oops, was there one missing? There we go. Oh. There we go. So there's one other bill insert on the slide before this one. It talks about our COVID-19 messaging.
Scott, can you go back one slide?
There we go. Thank you. So we have changed our messaging to specifically reference COVID-19. And we realized that a lot of our customers who may not have had financial problems in the past are experiencing financial issues because of the virus and the closure of businesses. And so we wanted to specifically address that and say, you know, if you need help, we're here to help. We have changed some of our requirements, so it's not a financial based requirement as much. If the person can show that they have been laid off or their business has been impacted, we will fund them now. It is not based on what their previous income was, because we realize that is something that changed suddenly. These bill inserts have been running in May and June and really are stressing, get help now. We want you to avoid a service disconnection. This is so that we don't have a whole lot of disconnections to benefit the customer, to benefit us, and to ease the burden on central intake, trying to get some of those people called up now so they don't have quite the rush. We also have been doing website and social media messages, and we'll do more when we actually come up with a date of when our cutoffs will start. Prior to that, we want to do a separate social media campaign that basically says your water and sewer bill pays for, and highlight some of the capital projects, the treatment processes we have, what's involved with delivery of treated drinking water or collection of wastewater, some of the energy improvements we've done to kind of plant that message in people's minds that the payment of the utility bills actually benefits the community. So that when disconnections do start, we've already planted this positive message in the customers' minds that utility payments not only benefit them by getting the service, but it benefits the community as a whole. And we want these customers to avoid a future disconnection. It is not in any of our best interest to cut off somebody, so we want them to get help now. Next. Our program has been very successful. We're starting to see more and more people in the past couple of weeks reaching out to central intake to get the help they need now. We still have a ways to go. There are still some people that have not asked for help, even though they still have delinquent bills. So we're going to continue with these messages, continue with social media messages, and promote through traditional media that we have this program available now, and now is the time to get the help you need. Thank you for allowing me to share this program with you. I'll be happy to answer any questions, or please contact me after the presentation if you want to have more information about Authority Cares or our Home Serve program. Thank you.
All right, Sarah. So a question for both you and Scott, maybe one of you are able to answer it. Somebody posted in the question and answer block, do you have a date time frame when you will be resuming non-payment disconnects? Have you already established what that'll be?
We do not have a firm date. We are looking at what the state is doing. We are not under the SCC umbrella, but we're looking at that for guidance, and are thinking right now, although things may change in our area, we're thinking maybe in August.
Gotcha. Okay. So then the second part of that question, when you guys do determine what it'll be, will you put that out in your messaging also to say, hey, on this date is when we'll start non-payment disconnects, trying to not so much scare people, but so much to kind of make them start reaching out for some of what you have available to them to help them out.
Yes, we want to promote that date when we have it to create some urgency, because we are still seeing that without the concern for a disconnect, some people aren't reaching out for help. So we want to say on this date, we will start doing disconnects. Please reach out for assistance.
Well, once you establish a hard date, it kind of really helps push people along a little bit more.
Correct.
Okay. All right. So if anybody has any more questions for Sarah on this topic, please post them in the chat or put them in the Q&A. Well, looks like we might have one more in the Q&A right now. It says, do you offer payment plans?
We do offer payment plans. We have not been pushing those right now. That is something we will start messaging when we have the cutoff dates, because to be honest, it's better for the customer to get this Authority Cares pledge that they don't have to pay back, as opposed to doing a payment plan. And a lot of our customers, even though they do get a payment plan, end up breaking that payment plan. So the better option is get the pledge from Authority Cares at this point.
Okay, perfect. Thank you. Let's see here. All right, so our current updates, and I don't want to cut Sarah short. If anybody has any more questions or any more comments for Sarah, go ahead and post them and we'll definitely ask her. Are you able to stay on till the end of the presentation, Sarah?
I can, yes.
Okay. So if anybody has any additional questions or comments for Sarah, if you can post them or put them in the Q&A, we'll get them to her. Let's see here. And there's one in there now about, does Dominion Energy offer water services? And it looks like somebody's working on answering that one. So situation reports and updates, current status of the pandemic. It's still going. Scott's going to talk a little bit about some resurgency, some areas that we're seeing growth here in Virginia again, where we're pushing out that 1.0 number. I don't want to steal Scott's thunder because he'll talk about that. Conference updates. So far, short schools and water jam, they're going to be pre-recorded presentations, which will be available online. There's more details to come. And then I believe I heard that the rural water is also looking to do something similar. Mike, are you still online? Can you speak to the rural water one that you were talking about on Monday?
Yes, they're posting some classes on their websites that are going to be like webinars and stuff like that. And then the National Rural Water Conference in Phoenix has been shelved, and they're doing a survey about doing it virtually.
Okay. So those of you that are rural water customers or rural water folks, keep an eye out for that stuff. That should be pushing out pretty soon, and we'll keep you up to date as best we can in our webinar as we find out about changes. Okay. Next slide, Scott. So here's our Virginia COVID-19 map. Total cases thus far, 63,203. Total folks hospitalized because of COVID to date is 6,262. Total deaths confirmed to COVID is 1,786. If you get a chance, you can go online to this VDH map. You can see there's a couple different tabs across the top, outbreaks, testing, so you can see where you're starting to see some surges, but also you can click on the individual counties if you're curious about what's going on in your area and see what the new cases look like and how many people have recovered. Next slide. So here's another snapshot from the VDH COVID-19 map. You can see we're starting to move down the bell curve. This one goes to about July 7th. We were talking about this a little bit earlier with us moving into the 4th of July weekend, and people start congregating together and celebrating the holiday in the fashion that true Americans do, that we may see some increases reported the week after. So we'll be keeping an eye on that too. Next slide. This is the UVA model dashboard for COVID-19 surveillance. This one is, what's nice about this one is this one actually shows the recovered rate. So we're sitting at 8,081 cases recovered. You can see the numbers still align with VDH's numbers of the 1,764 deaths, 62,787. I think the VDH one updates every day. This one probably has a little bit of lag behind it because the VDH numbers are just a little bit higher. Scott, did you want to speak to this? You said you guys like to use this one for part of your preparedness part.
That's actually the COVID Act now.
Oh, the COVID Act. Okay.
Right.
I believe that's the next slide.
Yeah. So, like Ike mentioned, this is one of the websites models that we follow frequently. We've shared it in the past. Virginia had dipped down all the way as low as 0.82 on infection rate. Below 1 is a decline in cases. We're beginning to see some influence of what's attributed for the most part to vacation travels, transport of cases, and a secondary element that's of concern appear to be restaurants and bars, which most people have probably seen in the national news. So we are seeing the infection rate in Virginia, unfortunately, climb back towards that 1. 1 is kind of the magic number on this. Above 1, you're seeing greater than 1-to-1 transmission of the virus for each infected person. Less than 1 indicates that you're seeing an overall decline. The contact tracing is effective.
Okay. If anybody has any questions, by all means, feel free to ask us. Scott's been doing a lot of research on those. Next slide. Warren updates. We actually got one national request that came in last night from Ohio, Warren. Mike, did you want to speak to that one at all?
Yes, they were looking for a pump, a submersible pump, and Geneva put it out today to all our Warren members.
So those are the kind of things that we do with the Warren is we field those requests out to everybody. So if you're not a Warren member and you're looking for things, becoming a Warren member, we can get it out to a greater population pretty quick to try and help you resolve that. So it doesn't always have to be for people. It can just be for equipment, or maybe it's just for some understanding or information or assistance with supplies, and that's what the Virginia Warren's really good at. We do have one new Warren member, Rapidan Service Authority, since the start of these COVID webinars. And then to date, Geneva wanted me to bring up that we've had 13 of our utilities on these webinars that have requested a second round of masks. This is the perfect time to start resupplying and stockpiling for the second round that CDC is anticipating is coming towards this winter time frame. So Warren has masks. We don't have the hand sanitizers and we don't have the thermometers, but right now we do still have an abundance of masks that we can get out to folks. If you haven't requested them for the first time, or if you still need your second round, just let us know and we'll get working on that. Next slide. And Scott Shirley prepared these slides. So I'm going to let him speak about phase 1 or phase 3, which as of today is the first day of phase 3 here in Virginia. Go ahead.
Yeah, thank you, Ike. We try to look at all the changes to provide an effective summary because we've all addressed the flow of information during this pandemic has been one of the challenges I think we've all learned from. Really in phase 3, the current indications are we'll be in phase 3. What's been suggested until there's an effective vaccination, or likely as an alternate, whether we reached herd immunity or saw a natural decline of virus, which the evidence to date appears that the virus is not going to give us the normal relaxation in the summer months. And so there's some question and debate about whether the escalation of cases are still considered phase 1 or whether this is really a secondary spike in the virus. So on phase 3, many of the requirements will remain consistent, including distance recommendations that most of us have implemented, disinfection practices. The masks are still required. I think everybody's tracked that. Ike mentioned we have a supply of those available. It's becoming more and more, and we've talked about this in past calls, the evidence on the ground and studies continue to support that the masks are one of the most effective means of reducing community transmission. And so that's a great national debate on whether masks should be required or not required. To some extent, that's unfortunate that encompasses many elements beyond just simply public health, because from a public health standpoint, the countries that have implemented mask requirements are the countries that have been successful in containing their spread. And so, again, it's just one for utilities to be aware of is while we're moving into phase 3, we've kind of learned a lesson. We'll share a little more details on that. Phase 3, pandemics are local. You will have local outbreaks. We saw this in the Spanish flu. That's going to be true in this pandemic. And unfortunately, with the mobility of our population, we see the risk of faster spread in areas that once had containment. So just again, we've asked that question in the past. Keep that in mind on masks. It's one of your primary lines of defense. Phase 3 does relax occupancy limits and extends the reopening to other business segments. That's some of the most significant changes. Conditions required for larger events, and I think it's worthwhile pointing out, the relaxation allows up to a 250-person event. However, if you look closely at the requirements for conducting an event of that size, personally, I think that would be a tremendous challenge. And so while it's allowed, it's one of those issues that I think everyone has to evaluate on a case-by-case basis for what activity they want to pursue, what meeting, what they're going to put together. Most associations, businesses have backed away from that because, as we note on here, liability for cases is a recognized risk. A lot of discussion at the federal level of whether there should be an extension of some liability protection to organizations who are complying with the regulations otherwise. But that hasn't been done to date, and so that's an open legal question on whether any liability may be incurred if somebody points back to a sanctioned event and says that's where I got COVID. So keep that in mind. That's kind of our best summary to try to condense down phase 3 for everybody. Next slide. So as Ike alluded to earlier, we're seeing the localized outbreaks in Virginia. Currently, and this is a few days old, I think we've seen a couple other areas that meet this criteria. And to be fair, I tried to sort these out as localities that are seeing a current uptick. Some localities are in the downward transition. So Albemarle, Brunswick, Carroll, Roanoke County, Spotsylvania, Warren County, City of Roanoke. It also encompasses the city of Salem, adjacent to City of Roanoke, and now Botetourt County. And so we are seeing localized increases where the localities are above 1, some substantially above 1, and that indicates that there is community transmission and some cause for concern. There's increasing evidence that vacation and leisure travel is transporting infection. And so we're seeing that documented state after state. We talked about the vacation policy kind of earlier. That was one of the intents of the vacation policy is if a jurisdiction decided to proceed with a lot of folks that adopted a no travel, that probably looks prudent at this point, but even if you didn't go to that level, if you wanted to relax, you should exercise likely some control over locations of employee travel. Next slide. So, unfortunately, we've been one of the localities dealing with this. Is what I call is a vacation souvenir, and this is one you definitely don't want. This is a snapshot of some headlines in the last couple of weeks since our prior webinar. Ohio and West Virginia were impacted. 17 high school students tested positive for coronavirus after a trip to Myrtle Beach. CNN headline that a lot of others picked up. Our local VDH came out and have said that anybody returning from Myrtle Beach should quarantine for 14 days. A little update on this third one. The more than 20 in Roanoke test positive, that's actually been updated now, and now the current number is in excess of 70 individuals that have tested positive for coronavirus after vacationing in Myrtle Beach. And so, as we've shared in the past, we had our internal policy on controlled vacations. Myrtle Beach was a fairly low case rate, and so our employees could select that as a vacation. Great example of what happened, though, is we had employees that in good faith followed the policy, booked Myrtle Beach, but the week they actually traveled to Myrtle Beach saw case rates increase 150 to 200 cases per day. And so they quickly blew the doors off the numbers. They're at a 1.6 transmission rate. And so then everybody's left scrambling with how do you address employees. It's, again, a voluntary quarantine suggested by VDH. And so we've worked through as an organization how to address employees who follow policy and mitigate impacts to them. Most people saw national news, the tri-state area of New York, the other localities that have joined, or states that have joined with New York and kind of a block to adopt common procedures because of their small kind of geographic footprint. They adopted a policy requiring visitors from COVID hotspots. They took theirs to a state level, and so that's the 9 states that they've identified with excessive COVID cases, and if their residents travel, they're asking them to quarantine. Next slide. So on the travel policy, as with everything in this pandemic, we've discussed kind of the evolution of policies, and we've all seen the phases where things change very rapidly. And so one of the modifications we've made to our travel policy is as employees report their location of travel, we're also incorporating the model that we showed earlier, the COVID Act Now, that's Stanford and several other higher education institutions that have created that model. We're actually using that. That model can have a drill down where you can look at county statistics or a locality like City of Roanoke. And so we're incorporating that into our virus hotspot and how to identify. Unfortunately, because Roanoke has been in the trend, as we've shared in the past, we use an average of the localities we serve. Sarah mentioned kind of earlier in her presentation, we serve as several counties, localities that are members of the authority. And so we look at an average. So even though the City of Roanoke is trending very high, most of our other locations have been still towards the lower end. And so the average gives us kind of a lower baseline for our employee policy. But if they are selecting an area that has a higher case rate than our local service area, we're going to go look at the transmission rate. And that gives us an idea. The CDC data gives you cumulative cases to date. So it gives you an idea of magnitude of problem in an area, but it doesn't give you a sense of time. And so we use the transmission rate to look at and say, is there a current risk of community transmission at the point of travel? And again, we're having that discussion internally. What if the Roanoke case rate continues to grow exponentially? There's some evidence that we're seeing in our surveillance that that's possible. So we're going to update that. And again, to close, local surveillance remains critical. Ensure that your current planning has provisions in the event that your service area experiences an outbreak. You can roll back to phase 3, but you need to be prepared of how you're going to migrate back through controls, what you're going to implement if you do experience a local outbreak. All right, back to you.
All right. Scott Smith, can you put up the poll question about following the phases? Should be our question number 2. There we go. All right, so our next poll question is reopening compliance. How closely is your utility or company following the Virginia reopening phases? And this is timely for what we have going on. So answer number 1 is we're following it strictly. Answer number 2 would be following it somewhat. Answer number 3 is following it somewhat loosely. Answer number 4 is develop your own set of guidelines that you're going to go by. And the answer number 5 is it does not apply. And this just helps us gauge where we need to be as far as getting some assistance or how we need to tailor what's going on with our phase reopening. We'll give everybody a second to talk about this. So while we're waiting for the answer, so as we know, like as I spoke earlier, we're going to have 4th of July weekend this weekend, so a lot of people are going to be getting together. So just bear in mind that we can see these numbers increase again. We can definitely see some new hot spots, not just Myrtle Beach. Virginia Beach could definitely become one. All right, some of our answers. 43% are saying they're following the Virginia reopening phases strictly. 33% are saying they're following the Virginia reopening phases somewhat. 4% are saying that we're following the reopening phases loosely. 18% have developed their own set of guidelines, and 2% are saying it does not apply. Okay. If I can move that. There you go. All right. So as Sarah talked about, we talked a little bit about communication, but pandemics, they're very fluid events. Evolution of the situation can occur very rapidly. So as we're seeing, even China right now, they're saying now that they're already looking at the next round of flu, that they're investigating it. And this one has some earmarks of a flu strain that we saw about 10 years ago. So you compile that on top of what we already have going on with COVID. As of right now, I don't think there's been an indication where this new flu has made its way into the transitioning into humans, but as we've seen with these things in the past, that can happen very quickly. So we need to make sure we're working through our communication plan, that we have some pre-scripted things that we can use, things such as, hey, we're tracking what's going on, we're maintaining a healthy work environment, maintaining healthy water, whatever our message needs to be, so we can keep our customers somewhat calm and let them know that we're taking and doing our due diligence to be good stewards of our water community with them. Messaging has been important, all the way from the beginning of the event to the end. You don't start coming out with messages and then stop giving messages, because then the vacuum begins and people will start filling that vacuum with their own interpretations of what's going on. Sporadic local outbreaks are these things can continue for quite a while. I mean, we're already seeing them, as Scott talked about. And we need to be proactive in anticipating what our crisis messaging topics might be. So we have this hair and dust cloud. Do we have messaging? How would you message that out if it were to move farther up off the Gulf and then into Virginia? We're moving into hurricane season. Are our hurricane messages ready? Are we ready to put together a JIC, a Joint Information Center, to share information and get information out to our public? Are we working with our PIOs and our PAOs to make sure we have these things ready to go? All right, next slide, Scott. All right, so best practices. I believe we have another poll question here about HVAC. It'll be coming up in just a second. All right, so this one is about HVAC changes. Have you made any changes to your building, heating, ventilation, air conditioning, since the pandemic? Answer number 1 is yes. Answer number 2 is no. Answer number 3 is do not know. Answer number 4 is does not apply. leave this other one up for a second. So some of our best practices recap while you guys are answering that is stay current on data and trends. Part of this these WARN webinars is to try and pull that information together for you guys so you guys can get it. Not necessarily that we're trying to interpret it for you, but we're trying to give you our best understanding as being members in the water industry also. Give you some ideas of how other water industries, other utilities are working this process. Evolving communications is another best business practice. Make sure that your communications stays up to date with what's going on in the news, in the public, and make sure we're ready to put out messaging. All right, we have our poll results. 12% are saying yes, that they have already started making some changes to their HVAC since the pandemic. 62% are saying no. 20% are saying do not know. And 6% are saying does not apply. And we'll explain why we asked this question here in just 1 second. Another best business practice right now is the restocking of supplies while they're available. I brought it up and Scott has brought it up once already, but we do still have an abundance of masks inside Virginia Warren that would be happy to get out to you for a second round so you guys can start restocking your supplies. Start looking at those chemicals that you were having a hard time getting. How many of them can you stock or store? A lot of them do have a shelf life, so we know we can't store them indefinitely. But are we looking at what are our other supply chains? What are other supply methods? Most of us by now probably got it pretty well worked out, but have we copied that down and written it down so somebody has to come in and do our job behind us because maybe it's our retirement time or whatever? Do they know how we went about filling those supply strain issues? Mike and I were talking about this, and Scott was on the phone too. They're having a hard time finding plexiglass right now so they can make their barrier. So when they do their reopening, and I'll let Mike talk on that in just a second. But the reason for our poll question was this ASHRA guidance on HVAC, and that talks about our using UV protection as part of the HVAC system to help with this coronavirus. Scott Shirley, do you want to speak on that real quick?
Sure, I'd be happy to, Ike. Early on, we started tracking ASHRA. The building envelope that our employees operate under, just as with masks, we're seeing increasing evidence, more and more studies coming out. One of the challenges of epidemiology is always to identify viruses that are airborne transmission. And you think about the nature of those studies, it's understandable why that can take some time to process and identify. And so hence we kind of ended up with a beginning narrative of droplet transmission. Subsequently, there's been some good laser studies, some unique and novel new ways to study that have been implemented. And we're seeing, and most people have probably seen evidence on national news, that there is more of an airborne transmission component than ever expected. And so that automatically brings in HVAC. And early on, ASHRA had recommendations on HVAC regarding modifications to your air exchanges, kind of best practices for dealing with airborne illness. They have subsequently issued a guidance of kind of emergency nature on COVID of what's being learned. They're trying to move on this more rapidly. They do have kind of a general guideline that's been produced for airborne illness. And so, as Ike mentioned, it's becoming more and more clear to me, at least from my evaluation, that there's a real potential benefit to modeling what's been done at hospital systems with the use of UVC systems within air handling units for our workplaces to help reduce this. And anecdotally, I think as we've seen transmission spots increase, frequently that's being attributed back to restaurants, bar areas, and so that automatically, especially in some of the southern locations, you're looking at the likelihood of HVAC having a hand in that transmission through the space. And so the UVC disinfection option for air handling, it's actually a very inexpensive unit. Give you an idea of order of magnitude. you're probably under $400 to retrofit a residential unit at your home. Us, for the authority, our total cost for our large kind of central building is under $10,000, and that's for eight air handling units with UVC installed. And so we're initiating some of that work. Actually, July 1st is kind of our trigger date. So going forward, we'll be installing that into our HVAC systems. There's also evidence that they've got a fairly quick payback. So you get other benefits besides, decreased filter change-out costs, a number of things. And so, again, there's increasing evidence, and in the future, we're hoping to have an actual representative on one of our warn calls so we can kind of speak to that and give you the best up-to-date information.
Perfect. And one of the things we did around this ASHRA is we actually went onto the WARM webpage. So if anybody wants to research or get any more information, we've actually hung the link there. So around restocking supplies, we constantly talk about supply chain issue impacts, and we think about those things that we touch every day as far as chemicals, as far as masks and hand sanitizer. But one of the things that Mike Lynn had ran into was the thing around plexiglass making shields so they can reopen their customer care area. Mike, do you want to speak to that real quick?
Excuse me. Well, yes. We have looked at our daily operation going forward for us to returning to customers coming in on July the 6th. And any area where we would have customer interaction with our employees, where it would be face-to-face, we decided to put up plexiglass barriers. We did that in our customer service area a while back, but then we decided where people come in and ask for their toilet rebates or have to meet with one of our employees, our administration area, we ended up taking the door off the hinges and building a counter space for social distancing. And then when we went to find plexiglass for that, we were told everybody was sold out, that they had it on order and it may not be here until after the middle of next week. So that's to be addressed. Another idea, if people want to look at it, if you have multiple employees working in a common area like our customer service clerks, we went to one of the local stores and we found clear shower curtains that we're hanging from the ceiling, which comes down past the dividers for the desk areas to kind of help with social distancing as well. And to back up a section on what Scott was saying, we actually looked at going with a higher grade filter for our HVAC units. And after we did our upgrade on the system, we come to find out that the system, if we put these higher grade filters in, it would cause too much of a restriction for our airflow system. So Scott's thing about using ultraviolet is probably a better option and a cheaper option.
Perfect. So, and basically what we're trying to show here is that the supply chain issues are just going to continue to grow as more and more resources are being used in ways that we hadn't thought to use them before, or into the amount of use that we hadn't used them before. So as you can find things to restock, it's a good time to start restocking and start preparing for the next round of whatever comes our way. It's just part of our emergency preparedness package. Okay, next slide. All right, do you want to put your poll question up here, Scott?
Yep, sure will. Excuse me. So one thing that we like to share with you is that we are offering these webinars for continuing education credits. And the best way to get those is to complete our poll. Which I think is up. And so if you've attended previous, what was that? Uh-oh, let me try again. Didn't like that. Is it doing it? Okay. Oh, there it goes. Okay.
There you go.
There we go. It gave me a weird error. So if you previously attended webinars, I have sent out transcripts through the end of June, so through our last webinar about 2 weeks ago. And I've received a couple of additional requests since then, so I'm working through those. But we are happy to issue those credits. The easiest way to get those is to complete this poll question at the end of every one of our live webinars. You have not yet received a transcript for whatever reason, just please shoot me an email. My email is on there on this slide, and I'll be happy to research it and get one sent out to you as soon as possible, but within a few weeks. But, you know, the one that went out in June was the biggest one for a while, so we'll leave this up for a few minutes so you can go ahead and select what type of credit you'd like to receive. So either water operator, wastewater, engineering, or none, just so we have an idea who was with us today.
All right, and then we have our contact information. So if you guys have any additional questions or anything that you want to see future topics about, let us know. One thing I do want to do is wish everybody a good 4th of July weekend. Hope that you have a good time with family and friends, and just watch those hotspots. Scott, do you have anything?
I'm good. I can just pass along the well wishes for 4th of July also.
Okay. Mike Glenn?
Same here.
All right. Well, do you have your answers there, Scott? For your
Yep, I'm going to let it run for another minute or so. Once again, we want to thank you for joining us today for today's WARN webinar. I'll share everybody else's sentiment. Be careful out there this weekend. Make good choices. Stay out of the hot spot. And we will look forward to having some more great information to share with you all in 2 weeks. So have a great day. Great weekend.
Perfect.
All right.